keep in mind that there were 5 coding clinics in ICD-9 that contained coding clinic advice from ICD-10, and to remember that when you're looking at advice for I-10, to go back into that process and have a look at that. Really the point to make is that second quarter 2000, we're going to review first quarter 2016 today primarily, but the second quarter 2016 is due out any day now. The coding clinic transition. At the outset, there was first quarter 2013, which gave us the information that there were no plans to translate all previous coding clinic from 9 into 10, which many people, including myself, understood to mean that all of the ICD-9 coding clinics sunsetted and all the 10 would be new information that we were to follow. And that pretty clearly became realized that that was not a practical approach, and fourth quarter 2015 told us that in general, coding clinics that contained information not unique to 9 remain applicable for 10 CM with some caveats. So as long as there was nothing new published in Coding Clinic for 10 to replace the ICD-9 advice, the ICD-9 advice would stand, and that was very helpful and a very reassuring perspective. Coding Clinic goes on to tell us that previously published I-9 advice that is still relevant will continue to be republished in Coding Clinic for ICD-10, which is almost a contradiction of the previous slide when they tell us that if the old advice was worthwhile, would still stand, that we wouldn't need to be retold. But there are certain issues that were just so complex, and they wanted to make sure that there was a smooth transition, that we saw that it was published again in ICD-10, reiterating that it was valid from 9 into 10 to create a smooth transition. Let's take a moment and talk about the hierarchy of guidance. And as you can see, I've listed first the conventions of the classification, second the official guidelines, and Coding Clinic is really third within the hierarchy, and some information as to how we know that's the case. The official coding guidelines, for instance, tell us, and as you can see, the instructions and conventions of the classification take precedence over the guidelines. Therefore, the convention, as it says, the rules in the book of see also, code also, sequencing, take precedence over anything that would be told to us in the guidelines. And very important statement is that adherence to these guidelines when assigning ICD-10 CM diagnosis codes is required under HIPAA. So there's so many reasons to follow the guidelines, but lastly, if you think there's any reason that you don't have to, keep in mind that that would be a violation of HIPAA. When one reads Coding Clinic, there's several themes that one should keep in mind. And the first is when you open a Coding Clinic to try to understand what are these questions and answers trying to tell us. And the information really takes a predictable pattern. First, we have the guidance that is the same as an ICD-9, and that is very reassuring. Then we have the guidance that is drastically different from 9 into 10. And that's always an eye-opener and gets our attention because we want to understand what has changed with respect to data collection and data reporting that would lead them to want to learn about these clinical circumstances in a different way. Next, we have corrections to the classification. Building a classification is a huge undertaking, and sometimes mistakes were made in the process. It was bound to happen. So Coding Clinic has stepped up and made some corrections and advised us of corrections to the classification. We have corrections to previous Coding Clinics, and like developing a classification, creating the guidance is a learning process, and sometimes mistakes were made, or we have come to a better understanding of the nature of how to use certain codes and certain combinations of codes, and Coding Clinic is now telling us that there are some corrections, and we will review some of those as well. A very optimistic approach is that some items in Coding Clinic are empowering. They're giving us, the coders, the ability to make decisions based on the information in the record. And then lastly, and this is a big improvement in Coding Clinic from 9 into 10, Coding Clinic has chosen to address certain complex issues with multiple examples and multiple bits of advice. Some of the examples you've probably noticed over the past several Coding Clinic issues are a number of Coding Clinics telling us how to handle reporting in the long-term care setting, or how to code mechanical ventilation given the variety of clinical situations one might encounter there. Debridement has a new number of Coding Clinics to address it. there were about 26 coding clinic questions to address the topic of how to assign seventh character for injury and poisoning and things of that nature. Most recently, procedure codes, a variety for how to treat cerebral hemorrhage and hematoma procedures, as well as this issue has a bit of guidance as to how to code obstetric procedures. So a big improvement when Coding Clinic takes a single topic and addresses it from multiple different perspectives.